Hi, this is PRF video part 2, preparation and use. I'm Dr. Douglas Mayo. In the last video we left off with the blood draw, and now we want to get ready to prepare the PRF and to use it. Now what's in PRF? You've got your clot at the top, the white blood cells, platelets which have all the growth factors, and water. All these things we need to help with healing. The red blood cells are at the bottom and they're not part of PRF. What's not PRF? First of all, it's not PRP. You see these terms out quite a bit, and it's not PRP. This is not a regular blood test specimen. There's no buffy coat. PRF is spun so that all the platelets in the white blood cells are in with the clot. So how do you prepare it? Centrifuge the tubes, remove the clots, use it as a membrane, a plug, or for graft hydration, or some combination of the above, but you got to know what you're doing as you're preparing it. Now again, you've got your instruments on the bottom of this picture for helping get the clot out. You got your compression lid, which goes over the perforated tray, and that's where you put the clot. And then you've got the bowl to bring the clots to the surgery or to take it and mix with your graft. Again, looking at the tray's perforated, so when you compress the clots, fluid collects underneath. And then there's also little holes with the white plastic that you stuff a clot, and you put the metal cylinder over the top to make a plug for socket grafting. And it takes about 4 to 5 minutes to compress and make the membranes or plugs. Now you centrifuge and prepare it. Make sure you put your balanced tubes directly across from each other. Close the lid tight, press the button. It's about a 12-minute cycle. Once that cycle's done, you can see now it's separated and the clot's at the top, the red blood cells are at the bottom. You close up the lid and now you're ready to bring that in. Now you want to get it spinning exactly as soon as you finish drawing. So that's just going to go right in the centrifuge immediately. Now use your tooth Adson to get your clot out. This is the clot with the which has the PRF. Now you got to use just an instrument here to kind of scrape the red blood cells off of that PRF clot. It just takes a minute. You just kind of have to tease it away. And you can see how you can use the side of the glass tube to help use that to remove the PRF clot. And again, you're going to put that on the perforated tray with an instrument. Get your second clot out. Pull that out again. Put that down on the tray. And at that point, go ahead and put your compression lid on top and the lid over the whole thing. You can usually let that sit for a minute. And then at that point, it's not fully ready, but if you want to hydrate with just the water at the bottom, which a lot of people talk about, I don't use it this way anymore, but you can, or if you have a lot, you can certainly do that. You pour some of that liquid from the bottom in to hydrate your graft and just mix it up. Again, this is backup too. If you can't just use all your clots to hydrate, then sometimes you need that extra water. Again, you put the compression lid back on because they're not quite ready yet after only a minute. Let that sit for another few minutes. Again, you pull the PRF membrane now, nice and thin. Sometimes it's on the bottom of the compression lid, and most of the time you'll see that it's on the perforated tray. You just pick those up with the tooth Adson, and now they're ready to use. So what do you use it for? Again, as we talked, you can mix it with your graft. You can cover over your graft, as you can see here in this picture, or over membranes, in sockets, under flaps, or in the sinus. So when we look at what we're doing now, I want to use all the great things that are in PRF to help with my graft material. And again, just using a liquid on the bottom, I'm missing all of the platelets and the white blood cells. So if I just take one of these gelatinous clots, and as you break up, you can see as I'm cutting up the clot here, I'm liberating a lot of liquids from that. As you do that, you can hydrate your clot with really the best stuff, which is the water, but now still mixed with the fibrin, the platelets, and the white blood cells. So you get everything you need in hydrating your graft material. And there it is. You can just scrape it over to the side. I've got more than enough in there, and the graft is nice and sticky and hydrated. Now, what are our indications? As you can see on the left, a lot of different areas or indications for PRF, but really anywhere healing is compromised. All these and more we've used PRF to help healing go. So if you have any questions, please feel free to message me on CDoc. You can also email me at easthudsondocs@gmail.com or check out our website at digitaldentalsurgery.com. Thanks for watching.